All right, well, everyone, welcome back. I'm here again with Tyler and LeBaron to talk a little bit more about hydrogen. Tyler, thanks for coming and meeting me. I happen to be, an hour and a half away from you?
Depends on how you travel, but 3 hours according to the law.
I'm in Las Vegas right now for the NHL Players Awards. We're giving away products to the players. You probably saw on our social media. It's just a couple hours away, and there's a lot more to talk about because a lot of the subjects from our last talk have been advancing quite quickly, and we ran out of time and couldn't touch on a lot of them. So if you are interested in reading more about hydrogen also, go to molecularhydrogeninstitute.com, which Tyler's the executive director. There's a lot of great stuff. You guys do a pretty good job of keeping all the studies, up to date. Do it once a year, twice a year, you download.
Yeah, I get so busy, but I try to get as many articles up there as I can. So right now, at least we're up to date from 2018. It's been it's been already 6 months. So
time has a funny way of moving, and of course, so many publications are coming out that it's you got to do a download every so often, and then it's just a flood because every year it seems there's more and more publications. I know 2 years ago I had read every single study that was available, and I was shocked, to find ones that I hadn't read. But now, every time I'm searching, there's new ones I haven't read, and I know I haven't read all the publications, but
yeah, they come out more and more from different universities, and that's the great thing. We're seeing more things out of Europe, more things, of course, out of China and Japan, and now we're starting to see more out of the USA. So it is difficult to keep abreast of everything that's going on, and so you start to look more into your areas of interest, what you're actually studying, instead of just everything on anything related to hydrogen, because now we have so many studies on plants, for example, as well, where before, I'm still very interested. Actually, we're working on a publication on plants, but it is a very interesting area, all of them.
Yeah, absolutely. And there's so many hypothesis papers coming out too. Those are some of the ones I'm missing. I find them cropping up all the time. Even I sent you that one by text, and you're like, oh yeah, I have seen that just like 2 days ago. It's just all the time. Every time I'm doing thorough searches and finding new ones, I'm like, I just can't keep up. There's new ones coming out like every day. And speaking of new research and teams all over, you guys just did the pig heart transplant. So we mentioned it. I believe we mentioned it in our first talk, that the big grant for any of our viewers, Professor Dosage and I had talked about it. He's really excited about the grants you guys are getting in Slovakia, and I'm not sure if you can tell me anything about it.
We did it.
You did it?
Yeah, we did it. I did post some things on my Instagram, which you're welcome to follow me at Tyler W. LeBaron. I just started it so I could post some of the different things. But while I was there, we did the research in Prague. We had surgeons there, and we were able to administer the hydrogen gas. We did several ways of administering the gas, both through respiration as well as into the blood with the oxygenator, because we did basically a coronary bypass, and so the blood would go from instead of going from the heart, it would go into a little machine, and then it would be oxygenated there, and we infuse the hydrogen gas there. Anyway, it was interesting, and we don't have the data and the analysis at this point right now, because what we did is, after we did the heart transplant, and then we resuscitated the heart to see how that's working. Then we took the heart out, and then we needed to take the samples of the heart tissue, and now we're going to do analysis on them. So looking at markers of inflammation, oxidative stress, and maybe just so our readers can understand why would we even do this. People actually do get heart transplants, and but what happens often is the heart transplant can go just fine, but then after that, the heart ends up dying with a lot of complications, and that's because you have what's called an ischemia reperfusion injury. And ischemia, that's basically there's low oxygen, and so if you don't have oxygen there, you're not going to be able to make ATP. Then you have reperfusion, so when you get the oxygen-rich blood to go back through the heart, then that actually causes most of the damage, surprisingly, because of course either if there's no oxygen there, then it's going to die. If once you do administer oxygen, then the cells are like, whoa, I'm not used to this, I don't know how to metabolize it, so all of a sudden that's a burst of reactive oxygen species, free radicals, that cause all these metabolic pathological changes. Just published an article in Molecules, maybe you could link that here for the viewers. In Molecules, it talked about some of these damage that occurs from ischemia perfusion. And of course we see hydrogen gas can help attenuate inflammation and attenuate a lot of the markers of oxidative damage and oxidative stress. Then it can make sense that perhaps the use of hydrogen gas during this type of a heart transplant could help mitigate some of those damages. And it's a similar article actually to what was just published earlier by Harvard Medical School and Johns Hopkins Hospital. They did a study with swine also with inhalation of hydrogen gas, and they showed very great therapeutic effects on preventing the neurological injury and I think kidney injury as well that occurs from this ischemia or perfusion injury.
Interesting, very interesting. And speaking of European research, we mentioned it on our first talk, the fatty liver study that's published now.
Yes, we were able to do that. I was very, very grateful to participate in that study with Serbia. And it's a small study, but those results, I still scratch my head. Is this really what it is? Like, it's a very, very high quality instrumentation that is used to assess the liver.
And very well controlled. It was double-blind, placebo-controlled. The placebo was a magnesium tablet that creates CO2.
Yeah, thank you. Actually, congratulations on being able to formulate that so well. That really helps. It's so important when we do the studies that we have double-blinded. It needs to be so we can't differentiate and tell a difference.
Yeah, no, absolutely. So for the viewers, our placebo tablet is the same size, roughly, the same weight as the H2 tablets. They disintegrate in about the same amount of time, and I got them to create kind of like the nano cloud in the same way that the H2 does, which was actually a little bit harder with the CO2 because it's so much easier to go into solution. It's so much more soluble than hydrogen, but we got that down, and that trial was not just the double-blind placebo control, but it was a crossover too, wasn't it? So it was pretty impressive data, from my observation. And I know the team in Serbia did that secondary analysis and abstract, right, with the HOMA2, and they had like an 11% increase in insulin sensitivity, which is incredible if it holds up.
It's interesting. The liver does seem to be a potential target, or one of the organs that seems to be more sensitive than hydrogen. When we look at cell culture studies, often we like to use hepatocytes because they seem to be maybe more sensitive to hydrogen. And when you do drink hydrogen-rich water, the liver does get a lot of that hydrogen because, of course, that's just the way that the circulation works. You go through the portal vein, you go to the liver, and so you're getting that burst of hydrogen gas right there. So it was really cool because we did that study earlier. You're probably aware of where a group that I researched with before, we showed that a higher concentration hydrogen water was effective for non-alcoholic fatty liver disease.
Whereas even a low concentration, wasn't.
Was not effective. That's right. Yeah, which some studies a low concentration is effective, but in our case we found that it needed to be a higher concentration.
And we'll circle back to this because I want to talk about some of my thoughts on dose-dependent response, especially with metabolic injury, metabolic issues in mitochondria. But I wanted to go in more. I know that you guys are still working on it a lot, so you can't go into detail, but we mentioned to everyone about the bigger metabolic syndrome study.
Oh, yes.
That was going on, and I know you guys are really pouring through the data and writing it now.
We have all the raw data collected, and we've done several statistical analysis on it. We just want to be sure with several things because the results really are quite good. And I wonder if maybe some people or some populations are more sensitive than others. So we're going through basically all the data to make sure that we're getting things done right.
Yeah, because it's really could be really groundbreaking for large segments of the population if it stands out. And I'm actually really curious. I wish we'd correct me if I'm wrong, but we didn't measure insulin sensitivity in any way, right? Insulin levels. So
yeah, there might still be some things that can be done, but that's not.
We can look in with what they did in Serbia and look at the insulin sensitivity.
Yeah.
I've been just thinking about it the last month since I was made aware of that. How much did that have to do, right, with the metabolic syndrome study?
Insulin sensitivity is interesting because we really don't know. We don't really know all the causes or what causes insulin insensitivity in the first place, and so even just losing weight, for example, just losing, again, improving your cholesterol and all these other clinical parameters, which we see in the metabolic syndrome study, then you should ostensibly see improvements in insulin sensitivity, and we see like the glucose levels were decreased in the study.
Absolutely. So I mean, I guess my thoughts on this were we saw in the fatty liver. I don't think the cholesterol changed in 28 days in the fatty liver study.
Yeah, 28 days is not very long.
No, it's not. So my thoughts were just going to, well, that's a dramatic improvement in insulin sensitivity. That seems to be coming first before the cholesterol drop, right?
Oh,
So,
I see.
I've just been thinking about it the last month. Is that a target that we should be looking for as one of the first, issues that starts resolving that leads to the amelioration and other things?
Yeah, I can see that, but I don't think we can say it can be that simple either, because there are many mechanisms. It's not just the involvement, like HMG-CoA, for example, to regulate cholesterol. Since which hydrogen gas actually has an effect in that area as well. But we could start having some sort of regulation on like ATP binding cassettes and different things, which involves the cholesterol efflux, and also several pathways involved in cholesterol that you would not see a clinical change, even though there's a lot of biochemical changes that are occurring on. And so it appears that, the insulin sensitivity increase did that first and then followed by this, but actually that doesn't necessarily have to be the case. It could still be the other way around.
And this is really good to look at these pathways because, and get your perspective on things because you're a biochemist, right? So sometimes you talk to the researchers and they're medical doctors, so they're looking at things in very different ways.
Yeah, sometimes those are the only ways that really matter because I don't treat patients, I don't draw blood, I don't do any of this stuff really, and so I look at things and I want to see the mechanism. I look at maybe even narrow minded in some ways, and just in this regard because you have to, right? And so medical doctors they can see things from a broader perspective, but you're right. Sometimes then they end up conflating certain biochemical pathways or something that really don't make any sense on this.
And it's what we talked about last time. Sometimes when the studies are written by medical doctors and not say they don't have a biochemist as part of the research group, they might have conclusions that don't make sense to a biochemist, right? Now the results are the same, but the story was...
Exactly. That's why it's so important for any skeptics or researchers. If you want to know, you need to actually look at the research and look at the data, look at the results, look at look what was observed, and then you can come to your own conclusion.
Yeah.
Just because, if you see this great study that was done and you show obvious there was a clear beneficial or clear biological effect, and then the conclusion is, and so we think that the Disney princesses, put their magic pixie dust on this. Like, obviously that conclusion doesn't make any sense, but that does not actually invalidate the results that were shown in the data.
And even in unblinded, no placebo-controlled quack studies that see no benefit, sometimes their conclusion is it didn't work because of this, still concluding that it should still work, and then people read it and they go, oh wow, so this does work. The scientist said it did.
Yeah, so you need to be cautious about some of those things. But going back to your main point, so sometimes there are studies that are done. The data can be totally fine, but the conclusion conclusions or the discussion is kind of like, well, that's strange. Like, why would you conclude that? But it's okay. Like, there's several studies like that, I guess, in all disciplines, not just hydrogen. I'm talking about studies in general.
Interesting. So, and I know, I think you guys in Slovakia have been talking with the Serbian team, Professor Dosage and his team
I've
about collaboration.
quite a bit, yeah.
I went and saw him at American College of Sports Medicine about a month ago, and he was really excited to start collaborating with you guys, really pumped about the heart transplant, and he spoke about it a little bit on camera with me, so I can mention it a bit to you now. So he's finished the case studies now. I had mentioned before the grade 2 ankle tears in soccer players. It's really cool data.
Kind of soft tissue.
Yeah. So exactly. So that's really interesting. And actually, just last week, they got the data for concussion, right? Which was, pretty interesting. So that's being submitted, and
the case study for
case study
concussion. Okay.
Case study. So I know TBI. It's something that hydrogen has been studied for. There's seems to be clear reason that it could do well. It's very important. Where I am today, talking to NHL players for the awards, concussions are a big deal there, and actually it's interesting, its effect on the brain, because I know you've kind of laughed before and said there's no data on that, but I gotta say, hangovers,
hangovers. Okay,
there's the big party last night, and I'm doing okay today, and anecdotally, we gave them around to a lot of the people at the party, and everyone's like, oh wow, I have more energy, or this made me feel better. There is one study that is indicative of increased detoxification from ethanol-induced toxicity. Is there? But it's not the greatest study because they were using RNA-only analysis and not Western blot for actual protein markers, and so there's some differences there. So it's not as conclusive, but they did show increased detoxification enzymes, so it could help maybe decrease some of the ethanol quicker, maybe decrease some of the negative side effects of the ethanol, oxidative stress, increased glutathione and superoxide dismutase levels. Yeah. And that's interesting because it is, because of course I was in Japan, I did research there for a while back in 2013, and one of the things that was quite common and was talked about a lot was how hydrogen gas and hydrogen-rich water was so effective for hangovers. And I remember I was visiting with Dr. Ota, of course, one of the pioneer researchers on this, and I said, people are talking about this all the time. Even these nightclubs are, I guess, adding hydrogen to their different things and everything. Why not do a clinical study? And his response is like, we want to do a clinical study. Maybe he's being a little facetious, but he's like, we want to do clinical studies on the things that we don't know if it'll work or not. Everybody already knows it's very effective for hangovers, so there's no point. It's a waste of money. Plus, you might run into some IRB issues getting people.
Well, yeah, if you go, then that would be interesting. And the study I talked about, that was actually in rodents, so it was not in humans, by the way. But yeah, there could be that interesting one as well.
Yeah, no, I mean, it surprises me every time. I don't drink to intoxication that often. I mean, as we're recording this, just yesterday, my part 6 of 7 on Hormesis was alcohol, ethanol.
Wow. There's a dose response though.
Yeah, it's a very, very steep, J curve or reverse J curve, depending on what function you're looking at. So alcohol is one of those ones. It can be healthy, but it's a very tight window. You go a little bit too much, and all of a sudden it's very unhealthy, and it only, tipping point of 1 or 2 extra drinks. So it's a big issue. But every time I need it, it continues to surprise me. At how effective it is. So it's just cool. It's topical. I'm did it today. So it just.
Yeah, I don't know. I mean, I've heard a lot of people say that. It would be nice to have a good clinical trial on that, and I'm sure in the future that'll be done. But it is a very commonly reported all throughout. Of course, I go to China all the time, and of course in Japan. But it is one of the very common threads. They're like, oh, gotta take my hydrogen. Oh.
Yeah, absolutely. So I'm not encouraging anyone to drink to intoxication, but if you do, give it a try. We don't have clinical data, but we've got a little bit of evidence. It sounds like there's sound reasoning on why it could help, and everyone seems to think it works. So that's interesting. Now I want to talk a bit something that has bugged me a little bit, and Professor Dosage and I talked about it a bit. The fatty liver disease, the NAFLD study came out, and now I see it being marketed and shared by like water ionizer companies that I know make 0.1, 0.2, milligrams a liter of H2, like below the therapeutic threshold that even you guys studied in rodents, and a fraction of what we used. And
I can understand the concern, and it is kind of concerning, but I think you have to be somewhat careful too, because first off, yes, in our study, we did this like 4 years ago, but I'm trying to remember. I think our low concentration
0.2 or 0.2 or 0.3.
I think 0.3. I think
0.3.
And there was no effect. So we go through the study. I'll tell you actually, just kind of sideline to get at that. There's actually a funny history behind this study, kind of how it happened. The researchers were originally doing the study, and they were very excited about functional water and alkaline ionized water because they saw so many positive things about that. And so they did the study, and they did alkaline ionized water, strongly reduced, electrolyzed reduced water is what is termed in the literature, even though it's kind of not accurate. But then they did control water. And then they did the study, and there's no benefits. And they were kind of confused, like, oh, well, I really thought there would be a benefit, but there wasn't any. And then they contacted me, this is in 2012 or so, and we're like, okay, well, let's look at this. How did you prepare the water? How did you do all these different things? And then we were able to finally measure the hydrogen gas concentration, and we measured it was 0.3 milligrams per liter, 0.3 ppm, and we're like, okay, well, that could be enough, but maybe that's why. Maybe it's not enough for this specific type of disease. Maybe it's not enough. Maybe we need a higher concentration. So let's do it again with a higher concentration of hydrogen. So we did use another method so we could make a higher concentration of hydrogen water and a lower concentration of hydrogen water. So we did about the same, 0.3 ppm or so. Yeah. And then we did a higher concentration, which I think was only 0.8 or 0.9 ppm or something. Maybe you remember what we did.
I think it was 0.8.
Okay.
Sergey and I were talking about it, Professor Dosage. We couldn't remember if it was like 0.7 or 0.8. It was still a very low concentration.
So 0.08 ppm. So it's still like 3 times higher than the other water. And then when we did the study, we saw that the low concentration, again, zero benefit, but the higher concentration, very obvious conspicuous benefit. It was just patently obvious, and it was very, very cool. And it also had a residual protective effect on the hepatocytes as well. So that was really neat. So we certainly confirmed several things about this, right? We confirmed that the benefit of this alkaline ionized water again was from the hydrogen gas in this study. Because the pH, that didn't matter at all. So when you look through the article, we did all of these adjustments to the pH. They did have a negative ORP, of course, the negative oxidation reduction potential, which of course is due to the presence of dissolved hydrogen gas. And when you remove the hydrogen gas from the water, the negative ORP is gone also, obviously. So it had all these properties. It was electrolyzed for a long time, just like all the other studies that were done that showed a therapeutic effect, but in this case it was not a therapeutic effect because the concentration of hydrogen gas was not high enough. And so we know that at least in some cases, in some conditions, some studies, you want to have a higher concentration of hydrogen gas in order to get that therapeutic effect.
Yeah, and we're still trying to figure that out, and again, we'll circle back and talk about some of my thoughts on this later. I want to hear your insights, but back to it. My concern is, a lot of these ionizing companies marketing the benefits of this actually deliver lower than the dose or than the concentration was needed.
Yes and no.
For mice only.
This is the confusing thing because it depends.
Yeah.
It always depends. So some ionizers, and then once you take just say the best ones, right? They actually, because there are
some do get a lot higher.
Right. Well, exactly. Well, some ionizers, they actually don't really do anything at all. They're just maybe just a total marketing scam or something else, but they really don't do anything.
Yeah.
And then a lot of them, okay, they can, but then you have to have the right parameters.
Yeah.
You have to have clean electrodes. You have to have a source water that has a high enough mineral concentration, TDS, total dissolved solids. If you don't have this, then, or if you have dirty electrodes, dirty as in, calcified electrodes, for example, then the concentration of hydrogen gas will be quite low. But if everything is perfect, the concentration of hydrogen gas can be a saturation, 1.6 milligrams per liter.
I don't know if I've ever tested one that high. I've definitely seen ionizers get to 1 or higher.
Yeah, they can even get higher than that, even up to 2 milligrams per liter. The problem is, when you have source water that is that perfect to get such a high concentration,
then they calcify
Then they calcify really quickly. So now, if you don't clean your machine daily or something, then
it's ruined forever.
Well, no, you can clean it. There are plant electrodes. You can clean them.
Sometimes the cleaning doesn't even repair them. Is what I know for a lot of the machines. Even after a deep clean, right, it never dissolves hydrogen again. You can test the hydrogen coming out of the nozzle, but something about the deep clean, it's changing.
It could change
the
surface morphology and
yeah.
things on the electrodes, but that could be because it's been calcified for so long. But if you were just to clean it every day, which still that's like 4 hours or 6 hours worth of work, or not that you're working the whole time, but just letting it sit and do the whole thing. But I'm just saying, when you have to do all that in order to continue getting the high concentration of hydrogen.
Yeah.
But then, when you do have a high concentration of hydrogen, you run the risk of drinking water that has a pH close to 12, which for some people is no problem because water is not a buffer anyway, so it shouldn't really have any negative effect. But at that high pH, which is just continuously being right onto the esophagus and the mouth and everything, that could start to cause problems. And for example, some people, they feel really thirsty when they start drinking the alkaline ionized water. They just feel a lot of thirst, and it's probably because really high alkaline water, it mixes with oil. They call that emulsification. It's more of actually saponification. It's actually a process called soap making, saponification. You can take lye, for example, the sodium hydroxide you get, and you mix that with animal fat. It's a process been done for hundreds of years, and you take that and you mix it together, and then you make soap, and it's saponification. So same thing, high alkaline water that has the high hydroxide concentration simply undergoes a nucleophilic reaction with the carboxylate groups on the fatty acids, and you form soap. And it just saponifies it, and then followed by emulsification, and now you mix oil together. But consider that high pH does that. Well, what are our cell membranes made out of? Lipids, fatty acids, and so it's doing the same thing. And so now our soft palate osmolar receptors basically can get almost damaged or weakened or whatever. So now they're basically very allow water to just go in and out really easily. And so we always feel that really thirsty sensation, I'm thirsty. This water makes me really thirsty. And then it takes quite a while of drinking the same water for Hormesis response for your body to kind of okay, and it makes that, repairs everything and makes it normal so that you don't feel as thirsty anymore while you drink that high pH alkaline ionized water.
So this is interesting to me because it is a lot of these ionizer companies that are the ones attacking my technology and saying it's not safe, it's not how water is supposed to be, or this and that.
But it's the same process though.
Yeah.
Electrolysis by definition adds electrons to the water to produce hydrogen gas. Your tablets do the exact same thing. It's just a metallic reaction, adding the electrons natural way. Anyway, it's just that's exactly the same chemistry.
And it's hilarious because if anything, our tablets are more natural in that sense.
Well, that's what the alkaline earth metals, right?
Yeah, exactly.
Anyway.
Than what they are, but no, that's interesting. So to be effective, they could even be damaging to get effective hydrogen. But then when we're going to dose, dependent response, even if they could get 1 milligram a liter, even up to 2, and then B12 pH, that's not that's not the dose that we delivered in the fatty.
Right. Well, that is a good point. Of course, we don't know if a lower dose would have been effective either. For example, in our study, in the animal study, we know that you at least had to be at 0.8 milligrams per liter. But again, that's a low concentration, but let's remember that actually rodents drink a lot more water. That'd be like you drinking like several gallons a day, which actually is interesting. I used to follow some of the ionizer camps out there, and one of the most common things that they would say is you don't start getting the benefits until you are drinking like a gallon and a half of water a day, which is interesting because by drinking more water, you're simply consuming more hydrogen gas.
Yeah.
And maybe their machines are producing, say, a half a milligram per liter, and now if you only drink a liter, right, 8 ounces or 6
you're not
ounces
getting a
of water,
benefit, but if you're drinking 6 liters,
exactly, then now you're getting enough hydrogen
like
gas
the
to actually
low
have a
thresholds,
therapeutic, right?
yeah, exactly.
And so in this animal study that we did, maybe the fact is there was a higher concentration, but they also drinking a lot of water. The rodents drink a lot more water than we do.
Yeah.
So yes, with your study, we don't know that a 1 milligram per liter concentration of 1 liter, so 4 milligram a day, we don't know if that would be enough to have the same therapeutic effects. We don't know that. All we can say is that we had about 5 to 6 milligrams per liter in your study.
Yeah, 6 is what they did by GC.
Yeah, but
I still think it would be higher. I know IHSA is finalizing the GC method. I think
we're working on that. But either way, all we can say, because that's what the study was done, that at this dose, this concentration was what resulted in these effects. And it is kind of misleading, I can understand, to use a study with this high of a dose and then say, oh look at these amazing results when you're delivering half the result, half the dose, and it's kind of
and best case half the dose if someone's drinking. Yeah. And then continuous rather than intermittent.
I'm just thinking of when you have nutraceuticals, for example, and there's these studies done on high doses of, say, this nutraceutical or this whatever, and then somebody else comes in and says, hey, we have that too, but they're using like 100th of the dose type thing, and that's very misleading. I understand that.
And some of these ionizer companies, and that's my frustration, some of them that are marketing it and using it in like multi-level marketing.
But remember, it's probably not the company.
No, it's
probably distributors.
It's on their
right?
distributor pages with like
but they probably don't
thousands
even know.
and tens of thousands, like sharing it around, and it's just I want to talk about it because I mean those machines often will get 1/100th the dose, in a liter to liter response.
If they're not cleaning them or they don't have that correct source water. So I can understand that. I imagine that many of the distributors just don't know,
And that's the thing that I think is important for the industry, and it's something Professor Dosage and I talked about. Is it's so important, that the IHSA is starting to at least setting minimum standards, right? Because there's so many products that they don't know the science, they don't know, anything about how the science works. They don't know the research. They don't contribute to the research.
Yeah, they don't contribute. And I have seen even some products market that they just say hydrogen-rich water because water is already H2O. So they're like, doesn't all water have hydrogen? And so they market spring water or any water as hydrogen-rich. And of course, that has nothing to do with our research. We do not research water, right? We research hydrogen gas. Now, I am interested in water. It's one of the great mysteries of life.
Yeah.
But that's not our focus is hydrogen gas.
Yeah, no, exactly. So it's why I just wanted to bring it up because I know the IHSA is coming, hopefully soon to the USA to start testing products.
Yeah, we've already approved H2 Analytics to do the testing and different things, and I think we just have to finalize the protocol for the gas chromatography. There's different gas chromatographies out there, and so you have to get the protocol that's right. We have to go through a number of tests to make sure that it's 100% accurate. It's a lot of work. It really is.
And for all the viewers, I put my money where my mouth is. Like I say, I'm always the first to hand my product over, right, for falsification and for others to test. So I know you can't talk about like calibration and all that stuff, but you guys already have my product, already testing with it. I was first in line.
Well, yeah.
And I'm not saying you guys have any data on it yet. I'm just saying I am the first to want to, or one of the first. I don't know other companies.
Well, there are other companies,
Yeah.
but we are interested in the tablets only because we know, based on stoichiometry, the gas evolution stuff, you let us know about the NDI, which from the FDA. So we have a lot of data we can go off, and it's just we're just using a lot of different balances and tests and different things. We want to test a lot of different things so that we can really make sure that everything is ISO type criteria.
Yeah. No, exactly. So I just wanted to, say that it's something I feel really strongly about. If I'm going to make a claim, I'm going to give it to everyone who can falsify the claim, because I need to be able to defend it, right?
Yeah.
I need that data, and if it comes and say your guys' data shows that I have a different level than what we're cross-referencing between titration, gas evolution, the other GC reports that was done, the Unisense hydrogen probes that
Looked at Beijing.
in Beijing, data we extrapolated from laser backscattering. We just need to take all that in consideration, right? Because this is still learning the art of this analysis to figure out its exact accuracy.
Yeah, it's a process, but it's that's how science works. It continues to improve and improve until it can't improve anymore, which suggests a higher probability that it's probably accurate.
Exactly. Now I want to go in a lot of this misinformation that we talk about. I published a month or two ago the article. I know you gave it a read. The 100 Voices when we talked about.
Which one was that one?
Needing 100 different channels to talk about hydrogen so that it could get out to the masses, and the issues that happened in Japan and Korea with marketers and our early talks, and if I really stand for honest marketing and messaging, in science, then I should open the tablets up to more avenues because another manufacturer might not have those.
It's just going to go. People are going to say whatever they want to sell the product, and that's terrible. We don't want that in the research. We need to control the message, because hydrogen gas, for example, doesn't give you hydrogen like food does. Like it's a different type of hydrogen, but people have marketed it that way.
And like another manufacturer, the tablets, and one of his brands and everything, talk like when they find, this doesn't make hydrogen, or not very much, or it's not as much as this other thing, they'll be like, but we put, crystal energy into it
I've heard that kind of stuff too.
And they start going into like quantum stuff, just making up stuff and saying it changes everything about your DNA to make you healthier and everything. So it's one of the things that I believe very strongly in now, in opening good dialogue, right?
Yeah.
So that we can have accurate messaging and make this available to all the channels, because I might not agree with everything that a brand stands for, but I can make sure that they're accurate about hydrogen, and I can help guide them and help educate them. So it's very important, because even still in Asia, we see a lot of misinformation and attacks. I know you don't want to go into it very much, but there's one in particular against me that I'm gonna have to go after these people. I'm seeing they're buying stages at conferences and basically committing slander and libel, because it's both spoken and written.
Well, there's a lot of misunderstanding. Korea. So you have to remember that Korea, for example, was one of the first early adopters of this alkaline ionized water, and energetic water, and structured water, and frequency water, and magic water, and other types of waters. And some of them based upon some really interesting science, and others based upon just a total scam. And what the difference between the two is, I'm not sure. But there's been this whole culture of that, and so when you get, I understand your concern, but I think you need to consider that some of these people have been giving hydrogen water to their patients and to their family and to whoever for years. I mean years, like 2 decades worth of time, over 2 decades, over 20 years, because that is 2 decades. Um, and they've been doing this, and they've seen all these benefits. And this whole time they've been doing this, they've been thinking it's about some structure change of the water or some energetic frequency that they've somehow infused into the water or whatever it is. But then they're seeing actual changes, actual benefits. And some of these people are just, health practitioners. Some of them are just whatever. They're not really, scientists or chemists in that way.
Yeah.
But they've seen these changes, and now we're saying, oh, everything that you believe, everything that you have held so dear to your heart, and you have thought is the reason that has healed so and so from such and so on. You're saying that it's all a lie, it's false. Like that's actually quite difficult to both accept and to deliver. And
I have a quote
right?
very similar to that in my 3-part series on don't trust the health experts, where and I target it to the extreme skeptics and the health experts. It was a quote, I think, by Daniel Dennett, and he said it's very difficult to tell someone that what they've spent their life on is meaningless, right?
Yeah.
What they find that they've dedicated their life to this word, and
right.
to say it's meaningless, you're wrong, right? There's no easy way to say that.
Yeah.
Right?
With one sentence, you destroy their entire 20, 30, year career. And so some of these people that you're involved with, not only is that occurring, where they're like, oh my goodness, it's all about the hydrogen, they actually don't get it. See, they're not fluent in English, they're not scientists, and so it's not like they can, like we just did, or we just talked about this very clear study. We take this water, we remove the hydrogen gas, the benefits are gone, we add hydrogen gas, and we make it very, very clear. They're not even aware of the simplicity of these studies because of the issues between English and Korean or other languages. And so you have so many levels, so many factors where they're the ones feeling under attack. As much as you feel that you're being attacked, they're the ones feeling that. They're trying to protect themselves. And unfortunately, things have been done that are just...
Well, and English is possibly a problem. And I'm writing an article about some of this stuff going on in Korea, but it's unfortunate because they had all the data, and the reason I say that it's libel and slander is because they had all the reports, all the data and everything. So if they reviewed it all and then went and posted that, then either they don't speak English and didn't understand
it.
The data, so they shouldn't have been doing that presentation,
yeah.
right? It's negligent. Or they did review it all and still went through
yeah.
with everything, which is like intentional fraud, right? So it's one or the other, right? Because
there might be some nuance there. I get your point, but I having been to Asia so much, it's just a totally different way of thinking, and sometimes I'm like, what? I don't get it. But I understand where you're coming from, and it is unfortunate, and as much as it makes you frustrated how some of these people market their products or their claims, it's upsetting to me, and as well as other researchers, legitimate researchers there in Korea too, because the Korean government also had recently come down on hydrogen and said it was kind of a scam and there's no real science behind it. Well, why did they do that? Well, they did it because these other people that you're talking about are talking about hydrogen water as some alkaline, miracle, energetic type frequency, quantum, hocus pocus bogus stuff or whatever, and
yeah.
that is what the government is saying. Oh, okay, so all of this together is hydrogen water, then yes, hydrogen water is a scam. And I totally agree. If that's your definition of hydrogen water, then it is a scam.
Yeah.
Unfortunately, they were given the wrong definition because the people with the biggest mouths, if you will, those who are marketed the most, are the ones not researching it in the lab, but are the ones trying to sell their products, and they're doing it incorrectly, which is why I was saying to you, I think for me too, if I want hydrogen gas to be out there in a good, reputable, respectable way, at least we understand what we're talking about, then these other alternative health practitioners, their conferences, their companies, they need to have access to the product because they are the early adopters.
And they are, and that's what I talked about in 100 Voices in our upcoming series. By the time this comes out, it might have already been posted on the hydrogen tablet origins, where I talk about development, people who came before me, and how I decided to get into it, and why I decided to private label. And it's just these important things, like we were talking about. A lot of these companies will say it, changes the frequency of the water, or like makes these magic claims, or they'll say it's, H4O or H3O. They just don't understand, and so yes, anyone reading that says that's ridiculous.
Right. You don't even need to look at a scientific article because, well, it just H4O. Come on.
Yeah.
That's not what you or it's making hydrogen peroxide. I've heard that as a common one, which
doesn't make any sense.
Which doesn't make any sense at all, right? Because we're talking about additional hydrogen, not additional oxygen. Hydrogen peroxide is H2O2, right?
Yeah.
Anyway, so that one's a kind of funny one, but yeah, absolutely, and that speaks probably two levels, I think, to understand. Number one, that it's important that these alternative practitioners of these other channels or whatever that believe in good things and are trying to spread a good word. They're at least their intentions are pure. That's what I'm trying to say.
Yeah.
Their intentions are pure. That's what they want. Let's give them the correct product. You give them the correct product, the correct information, the correct education, so that when they're talking about this, they at least say it correctly. And then number two, as I was saying, is unfortunately a lot of the science that gets out there is not the accurate actual science that we see in published journals, but the marketing stuff, right? And so that's why, like, really for me, that's why I decided I need to get in front of a video camera or put a website up and let people know about the research on hydrogen gas. This is a real medical gas we're talking about. We're not researching some, esoteric frequency thing of, hydrogen pH stuff or something.
And this is actually what I want to talk about next, and I go into this a little bit in my open letter to industry and skeptics about the use of testimonials, right? You have to get your research out there, right? You need a platform to get your research out there. It's just the scientific world we live in, because if nobody knows about your research, you're not going to get any grants, you're not going to get other research teams
to be interested
in get involved, because that's what science is about. You want numerous teams looking at it from numerous angles, replicating work, going down different avenues with the work. You don't want to keep your research a secret, right? Because then what benefit does it have? Right? You're just sitting on...
If it actually is good, then you're a crook, and you're to humanity, because you're taking something that could be beneficial. And if it's not good, and you're saying you have this magic here, but all my research is stuck up in the Russian archives of whatever, then that's a serious red flag.
No, absolutely. There's a bit of an inside joke about another magic water that's emerging on the scene right now that has no good evidence, but they're saying that there's all this secret Russian research.
Well, there's always Russian research behind stuff, but that is the interesting thing, that it's unfortunate, but it's so true that most good real researchers, they're the last ones who want to be in front of the video camera or out there publishing or publicizing in the media, like, about what they're doing, because that's the last thing that you do as a scientist. That's like science 101. That's a general thing. Like, the very first thing that you do when it comes to getting your research out there is you first take your research to other scientists. Get that research to be replicated. Get that research to be reviewed and scrutinized and try to be falsified by other teams. Only after it passes all of this stuff, then should you come to the media. But the problem is, so many other products or companies try to take that research and jump the gun and get to the media before, and they misinterpret and misattribute and totally, don't explain things correctly about what the research really is, and so they give that research a very negative view, very negative perspective of what's going on, because it's been kind of ruined. And so it really does behoove researchers, once they have published articles, even though they don't know all the details. I don't know all the details about hydrogen. I have more questions than I bet you guys have about hydrogen. But we don't have to wait till you have all those things answered to come forward, and that's why I'm just here to say this is what I'm doing. This is what others are doing. This is what we know, but we still have a lot to figure out.
So, with what you're saying, it really seems ridiculous that a lot of skeptics will attack scientists for getting on all sorts of platforms to try and give honest messaging, right, about what's going on, because it's so necessary, right, to not just get out and talk about your research, but to talk about it in channels that might be incorrectly misinterpreting it, to give them
The
more
best information.
Exactly.
They're not really the conventional. Because typically, as scientists, we want to go to your mainstream academic conferences, your symposia. You talk to other researchers. You get other research groups to both analyze your data, to try to falsify it, figure out maybe what you did wrong with it. That's why we really want to go to these types of conferences. If you just go to these other conferences where you just get these doctors who just want to accept everything, then it can be misunderstood and misinterpreted. So I get. Skeptics or others, they quickly want to attack any scientist or any doctor who goes to these other non-conventional conventions or conferences and gives their information, because a lot of times those doctors are speaking outside of their areas, or they're trying to sell a product, or they're trying to do whatever, and they're not doing what you're talking about. What you're talking about, I think, is critical, that you get a scientist to come to these conferences and they speak about what's going on in the research, and they use those platforms to educate the public, because the public, they don't know science very well, but that's not always just their fault. It's often the scientists' fault, because they're so concerned, they're so concerned about being attacked that they don't want to go out. I'm concerned. I don't have all the answers about hydrogen gas. Like, there's so many things I don't know. As I said, I have more questions than probably any of the audience does. And yet, I'm putting myself in this rather precarious position to oh, look at me, I'm going to answer all these questions on hydrogen. Well, I don't know. Yeah. But I'm trying to let you know what we're trying to do in the research. And so, yes, people will attack me and like, oh, hydrogen gas and whatever, the strawman fallacies or whatever they want to make up or say, but the fact is many people want to know the science. They're interested in the science. They want to know what it is, and scientists need to come up to the plate and let people know. And it's unfortunate that it's challenging, because it's so easy for others to just attack them for doing that.
Yeah, no, and it happens so frequently, and it's just so unfortunate, because you do need a platform to get the research out there, right? You need this, and the more interested, the population is, the more grants are issued to study things. I mean, right. we see sham therapies that we know don't work that still get thousands of, studies, research grants. Like, and I'm saying thousands of grants for individual studies, not thousands of dollars, like, millions or hundreds of millions of dollars. We know it doesn't work, but because it's so popular, right, they just keep getting grants for it, right, to continue doing research. So when something is new, you need to get a voice out there to get accurate science, to get people interested, so that we can continue researching it, and also for it to be accurate, because you want the marketers to be at least reasonably accurate, and so the media is reasonably accurate. If scientists aren't talking about their research and marketers are making these magic claims, then journalists will look into it and be like, oh, well, that's crazy.
Well, we had that instance, I think you and I talked about this before, but some of the articles that came out in some of the mainstream news media outlets, they originally claimed that the benefit of hydrogen water, the claimed benefit of hydrogen water, was to alkalize your body. That hydrogen water is the same as alkaline water, which is a very common misunderstanding of course, hydrogen water does not alkalize the body.
No.
So they automatically made that assumption. Well, we know alkaline water is not a buffer. It can't, buffer the acids in our body. Even if one is to subscribe to the claimed alkalizing benefits of alkaline foods or alkaline diets, you simply can't do it with alkaline water. So conflating the two together is a serious problem, and that major news media that did that in the past, that's very unfortunate, and that's very sad journalism also.
I believe they falsely attributed quotes to not just you, but one of the other people that were interviewed, a professor.
Yeah, they kind of fabricated their own quote and then
refused to take it down.
Yeah, eventually they did make some very important changes. I guess somebody went to the top editor or something. But anyway, there's some really, it's just, you just can't trust it. And it's the same thing, people will let's say that let's just use hydrogen as an example, right? So let's say hydrogen is somebody's area of expertise and has studied it for, 20 years. I've been studying it for 10 years now. And so I understand what the things that we know or the things we don't know about hydrogen. And then they'll go to someone else. So they'll just go to some doctor of I don't know, just a normal doctor, right?
Yeah.
And they'll say, "Hey, what do you think about hydrogen?" They're like, "I've never heard of it." Like they have no idea. Like there's hundreds, now over 1,000 publications. The doctor doesn't know. So what is any good canned response? If you are a logical, conservative, good doctor, and somebody asks you about the benefits of whatever, your answer should be, well, I don't know, I'd have to look into it. Okay, here's a bunch of articles. Well, then you can obviously say after that, well, there are some scientific studies, but I don't know much about it, so I'm quite skeptical. And so the journalists report back, well, these people say such and such, but all these doctors, they're quite skeptical about the benefits. Well, and as you should be. And I'm skeptical about the benefits also, even though I do know all of the studies out there. But the fact is, at least I know what the studies say, and I've actually read a couple of them, maybe even actually have done a couple of them. And anyway, I just don't think it's appropriate to put the people on, this an expert on the same platform. They're experts in totally different fields.
And it's that joke, and I've shared this one with you, that a lot of journalists think that they need to give balanced reporting on topics that have fake controversy about them.
Right. Yeah.
If say you're reporting on the weather and one person in your office says it's sunny and another says it's raining, you don't report both sides, you look out the window, right, and see. But journalists don't seem to do that these days. Some of the articles that have been published have said there's no human evidence that it works. There's now 65 published human trials on hydrogen therapy. I think about that many that are either being written or finished and being written, data collected or underway. So there is a growing volume of human evidence, and it's growing quite quickly.
And actually, most of these, 99.9% of these studies are all funded by governments.
Yeah.
They're not, even your studies, as grateful as we have been for you donating your product, maybe some additional funds to give us some money so we can look at different markers.
And that's one thing I want to do. As I have said ad nauseum over and over and over again, I really believe in open research, right, and under no publication agreement. So I have in some of the studies donated some extra funds for markers. I've always provided product and placebo at no charge, right, designed the placebos. But if I think it's important, if say the grant is restricted and you guys were like, we really should be testing these other things, I donate so that we get a better picture of what's going on, to make a better study, right? To make those, public grant funds go longer, because that's what it's about. You want better research.
Yeah, exactly, and that's what we want. We want to have better research. We want to have more data, and that is one of the concerns even in the beginning was, we don't want to get into any type of relationship where they're going to control our research or what we can or cannot publish, because the fact is, if we do a study and we use your product, or anyone's product for that matter, and we don't see favorable results, we want to publish that. we want people. We want to understand. That's the whole goal, is to understand.
And that's the big flaw in privately funded research, or even sometimes public research, right? If you don't have to publish the data, what if a company does a study 20 times to try and prove what they're doing works, and the first 19 sees no benefits, but they keep changing the goalposts, moving the goalposts, changing the parameters, and the 20th time they get it to show a benefit, right? Now they know how to rig the study to keep showing benefits.
And that's we see those problems with even in pharmaceuticals, how many studies they have to show to get the FDA approval. So there is a lot of corruption on that side. We're aware of that. It happens. But there's the same corruption that's going on in these other fields of research too.
Well, for sure. And I've seen, plenty of, public studies where I find the registration on clinicaltrials.gov, and it's 9 years old and there's no publication.
Yeah, they didn't follow through.
They didn't follow through.
They should.
Right?
Yeah, they should be obligated to.
It should be the law, right? And that's what Ben Goldacre is pushing in the alltrials.net campaign, that we need all data, because we do not know what works unless we have all the data.
Well,
unless we have the failures.
Even some journals don't want to publish articles unless it has a positive effect, because it's all about impact factor and marketing, which we don't really need to get into.
There's flaws in the system at every level of the system that need to be addressed. So this isn't some single conspiracy going on in science.
Well, that is a problem. When people, and I've seen this, when these other people start trying to bring up a conspiracy things like, well, we can't get our articles for our studies or whatever published in these mainstream medical journals, or get them published in whatever because it's a conspiracy, or because whatever. That's not true. We publish all the time in these journals.
Yeah.
And that's because we do a legitimate study, and we do it according to the scientific method, and we submit it for peer review, and if it's good, it'll get accepted.
Yeah.
And if it's not, and sometimes it takes over a year to get through the peer review process, because the reviewers, they want to know, okay, what about this, or have you looked at this, or how are you sure about this? Always trying to figure out what is the problem with your study, because it should have not shown any results. That's the goal of a science. A scientist always says this doesn't work, and if it does work, then you probably have a methodological flaw. And if you can't figure out any methodological flaw, and you can't confirm that it doesn't work, well, then maybe it does work, and then science just continues going that way. But the point is you cannot fall victim to this idea. Well, not you in general, but I'm saying people can't fall victim to the idea that, well, the only reason that people haven't validated that this new magic whatever such and such potion lotion works is because of the conspiracy, because you can't publish it in good journals. It's really not true. You can't. You just follow what's called the scientific method.
Yeah.
Yeah.
Absolutely. And now, before we go farther away from the topic, I want to talk about from a biochemist angle. Professor Dosage had that really cool study really early on in athletes, showing it reduced lactic acidosis.
Oh, right. Yeah, there's several studies actually.
Wouldn't be a direct buffer, my understanding, but there is some good reasoning.
It depends on the product, right?
Yeah.
Because of course, hydrogen gas, as we talked about, has nothing to do with pH.
Yeah.
So of course, if you took hydrogen gas and dissolved it into water, the pH would not change. It could be in acidic water, or alkaline water, or neutral water, or whatever. It's not going to affect the pH. So hydrogen gas alone does not act as a buffer, right? Now, can it have a buffering capacity somehow physiologically in the body? Well, then maybe we go into some stuff. Well, okay, if hydrogen, for example, the main buffering system of the body is the lungs and the kidneys. So maybe you have an impaired lung function from inflammation, impaired kidney function or something. So could hydrogen improve the function of the kidneys and improve the function of the lungs, and now your natural pH regulators of your body start working, and so that can get hydrogen gas itself could indirectly help to maintain normal pHs during like high intensity type exercise where you do start producing lactate.
Yeah.
During the production of lactate, when that's occurring, you're also producing high amounts of acid, and that's because you don't have enough oxygen. Well, you actually do have enough oxygen. Well, okay, so we're just saying when you are exercising at the high level, normally you make your ATP or adenosine triphosphate in the mitochondria. You make a lot more ATP there, but when you start exercising at a higher level, the rate by which you can make the ATP is not fast enough for which you need the ATP, right? And so you stop using the mitochondria, you start undergoing glycolysis, and during glycolysis you start producing lactate, and that process of glycolysis you produce a lot of acid as well, a breakdown of ATP and your hydrolysis of that, breakdown of glyceraldehyde 3-phosphate, other areas you make a lot of acid. And so the production of lactate correlates with a lot of acid. So if hydrogen gas, maybe you can improve the function of the mitochondria, and by so doing, you prevent or decrease the occurrence or reliance on anaerobic glycolysis. And so by using less glycolysis, you are therefore producing less acid. And if you have less acid, well then your pH is normal, right? So there's those ways too. But the last thing is you have to look at the product, because sometimes I think actually in that study you're talking about, they used a product that produced hydrogen gas, but it also had some bicarbonates and some like calcium or sodium bicarbonates or something, and even magnesium itself in this form, this metallic form magnesium, as it reacts, all of these can increase the pH directly and act as a buffer in this case. And so those right there could be responsible for preventing an acidotic state. But in terms of hydrogen gas alone, of course, hydrogen gas does not.
Won't directly, but maybe indirectly.
Yeah, for all those reasons explained, yeah.
Well, I mean, that's pretty much like everything with hydrogen. It's indirect.
Yeah.
Go down. I want to go right in to talk a bit more about hydrogen and hormesis. So, congratulations! You've had 2 reviews just published in the last couple months.
Yeah, they're pretty good articles.
I know you've been working on the sports review for
quite a while,
quite a long time.
Mm-hmm.
So you're proposing, and you mentioned it on our first talk, that hydrogen's a bit of an exercise mimetic, right?
It just sounds good. It's good marketing.
Now, as I've been pouring into it, looking into it, I've been thinking that it's as much, or seems to be as much, a caloric restriction mimetic also. And it's interesting because I know a lot of people are using hydrogen during fasts, water fasts.
Yeah.
And I know you've read what I wrote. Feel free to criticize me. Any thoughts?
Sure, that's what I do best. Well, I mean, I think, first off, I do like the idea of thinking of the fast mimetic as well, only because some of those same pathways that are activated by fasting can be activated by hydrogen, just as in the same way that pathways activated by exercise can be activated by hydrogen as well. Of course, to truly say it's a mimetic, there are certain definitions and terminology and things that we'd have to really analyze to see if it's a true mimetic for exercise or true mimetic in fasting. But as a general idea, it does seem to fit both of those categories. You could say in some ways that exercise is a fast mimetic, right? And you could say that fasting is an exercise mimetic.
Most forms of hormesis activate very similar
right,
pathways,
exactly.
you know?
So it's just people generally understand that fasting or exercise more so has a lot of benefits, and it does so by activating many pathways which hydrogen gas also activates. So, but yeah, there are a lot of really interesting some studies even with hydrogen gas. We talk about fasting, just a couple interesting points with that maybe. One, I always say this, that one of the first things that happen when you start fasting, most people realize this, but maybe they don't fully get it though. But the first thing that starts happening when you fast is you get hungry, and the reason why is because you start producing, one of the reasons why is because you start producing this gastric hormone called ghrelin, and ghrelin is a lot of, it makes you hungry, but it also has a lot of therapeutic neuroprotective benefits as well. And drinking hydrating water is able to induce gastric ghrelin secretion, and so it provides those benefits there. But the other thing, the main thing when we talk about fasting, the main thing that is talked about when fasting is talked about is autophagy.
Yeah.
And that is basically
and it's interesting because hydrogen is actually shown to regulate autophagy both up and down, depending on the model.
And that's what I wanted to point out, which I think is really interesting. First, so you understand the whole autophagy thing is, of course, on our cells, they get older, get senescent, or they have different problems. Then they can go, autophagy just means self-eating, right? And so it can get rid of those bad cells. And you don't want too much autophagy because that's how you end up getting atrophy or apoptosis or just cell death, because of course the cell ate itself up and it's gone. But you do need to have a continuous kind of this balance, a little bit of the eating, a little bit of not, right? And it just kind of goes back and forth, and so you have to have autophagy going all the time, and so you don't want too much. That's why fasting for a long time, like months, years, eventually that will kill you. Actually, if you don't eat, you actually will probably die. In fact, you will. Research has shown that you will.
I can quote you on that if you don't eat.
Yeah. I've actually looked at statistics, and research has actually also shown that the more birthdays you have, the longer you live. So with that in mind, we consider that you don't want too much autophagy, and you also don't want to not having autophagy. So just eating all the time, right? That's going to always be activating the mTOR and preventing autophagy from occurring. So as you mentioned with hydrogen gas, it's very interesting because depending on the salt or the need of the cell, if you will, hydrogen gas helps to regulate autophagy, and so in some cases it can prevent excessive autophagy, or in other cases it can help induce autophagy, and thus leading to a therapeutic biological effect.
And that seems to be the case with hydrogen often, and that's why I really don't like calling it an antioxidant, because it can be a pro-oxidant or,
right,
anti-inflammatory, because it seems to regulate a lot of these
right,
processes based on what's needed, right, in the model at the time, which means it potentially has a lot more implications.
And it helps to explain the panacea, if you will, of hydrogen, because it's kind of, well, not kind of, but literally a red flag. Like hydrogen gas helps with this disease, and this one, and this one, and this one, and it's just all these things. If it's a disease, that means hydrogen can help. That's not really how pharmacodynamics work with drugs and things. But when we start to understand hydrogen more as this adaptogenic redox modulator that's able to regulate so many different pathways, we start to understand why hydrogen gas could have so many different ubiquitous effects.
And I want to go into this actually, because this is really important. And I originally said I'd never fully fund any trials, right? Because I don't want that conflict, but it's frustrating how little replication work gets done when it's all public funded, because teams don't really want to do a direct replication of another team's work. They want to find something novel and new, right?
Yeah.
So I'm actually changing gears a little bit, and I'm looking into fully funding my first trial as a replicative trial of a public research. It would still be under no publication agreement.
Yeah, as long as there's no publication
agreement. It would still be under a no publication agreement with a university, right? But it would be no grant funds, right? So that we can look at these targets and replicate the work, because a lot of skeptics will say, this is garbage. There's so many studies on so many different things, very little replication work. Because in pharmaceuticals, you can just run the same study over and over again. Once you've found where you want your goalposts, they just do it over and it's replicative. And that's actually less telling than something that has such a wide range like hydrogen. We start understanding it more
well, I
a
think
broader
the purpose
sense.
is also different. And with the drug, you're trying to really demonstrate to the hygiene that this drug works for this disease and this target, this organ, this receptor, or whatever. So you work on that, get the FDA approval, and then push it, market it, and so on, right? Whereas with hydrogen gas, that's not the goal, right? We're trying to understand. So many research groups are trying to understand its wide-ranging, ubiquitous biological effects. And even with the drugs, as soon as, say, that patent runs out for this drug, they just repurpose the drug, right? And they say, okay, well, we worked for this, but now let's see if it'll work for this too. You know, so they do actually the same thing with drugs. It just does it over the course of 30, 40 years.
Yeah. Whereas hydrogen, it's like we have 100 different races that people are taking small steps.
Right.
In different directions.
That's actually
than
one of the
directed.
problems with hydrogen gas, is because it does have such a wide range effects on so many different diseases. Then people who are interested in Alzheimer's, I want to look at that for Alzheimer's, right? People who are interested in Parkinson's, for this, and then rheumatoid arthritis for this, and then metabolic syndrome for this, and all these different diseases. Instead of a focused, concerted effort, okay, we are going to look at hydrogen gas for ischemia perfusion damage due to coronary bypass surgery or something. One specific thing, and we can just do many, many studies on that specific thing. Then, that's when we can start looking at what is the dose response, what is the concentrations needed, what is the best method of administration. All of these things are typically we have to focus on one disease model, and then we work on the cell culture with the in vitro systems from the exact primary targets and what's it doing in the cells, the animal models, many different animal models for that type of a disease, and then into the clinical studies, and then different populations, different genetics, different durations, different method of administration, all these things, all very narrow on this one specific disease. That's the kind of studies that you need in order to really understand a drug, and in this case, hydrogen gas.
Yeah.
And again, because hydrogen gas has all these effects, kind of all over the map, it's just really difficult to do all of that.
Now, I do feel that we're starting to narrow it down a little bit on understanding when hydrogen can be, say, an adjuvant, therapy, or at least guess better, make educated guesses, and where it can be very impactful. And in my talk with Professor Dosage, we just kind of chit-chatted. I mean, with your work, calling it an exercise mimetic, going down that, and where I think the most promising data is, at least especially considering the studies we have just published and coming out and everything, it is for these lifestyle diseases like metabolic syndrome, fatty liver disease, and that's his research has been either in these lifestyle diseases, like obese populations, or as a performance enhancer for exercise. So to me, it's interesting because he's the first researcher, and he is a medical doctor, so maybe he had an intuitive sense of where he thought it was going to work, but he seemed to pick good target populations, for it.
Well, hydrogen is not one thing. Hydrogen is not a cure-all for sure. For example, if somebody's dead, hydrogen gas won't bring them back to life.
Yeah.
Although there is an interesting story about that in Japan. But one thing though is if there's so much damage that is done, obviously hydrogen gas won't be effective in those cases, right?
Yeah.
And so these serious things that occur, hydrogen gas is not like morphine or something, and that's why it's not. Typically, most people who take hydrogen gas, I don't know. I mean, you probably know better than me, but I was going to say they don't really experience a noticeable thing right off the bat. And maybe you get different reports, but I'm just saying that
some do. I'd say a small, maybe. Professor Dosage and I were talking. Anecdotally, it seems roughly 4 in 5 people notice a benefit within at least a couple weeks. Time.
Oh yeah, a couple weeks. Okay, so but maybe, I would say maybe 80% or something.
Maybe
so let's see.
1 in 10 seem to notice this rush of energy and tingling through their head on the very first, within minutes of the very first time.
I have heard that quite a few times actually, which I don't know. I don't know.
It just it strikes me because I'd say placebo, but everyone describes the same thing.
Yeah.
Like even yesterday.
Well, people describe a UFO the same way too.
For sure. for sure. I mean, that's true. Even yesterday when we were sampling hydrogen water to, the NHL players nominated for the awards, their family, their trainers, managers, everything. The one woman, she drank it, and we're talking 2 minutes later. She's like, how much caffeine is in this?"
Oh, really?
Right? And I said, "There's no caffeine in this." And she's like, "Oh, I just feel it, like my body is rushing, my head is tingling." Right? So she knew nothing about hydrogen. It was the first she'd ever heard of it, but yet again, it was that same.
I have had.
anecdote.
I actually gave hydrogen to a friend who's a chemist, a professor of chemistry, and I was just telling him, I was like, I'll try it. He drank it, not even very much, and then he sat down and he was like, "I don't feel very good," and he was like lightheaded, and then he was like, "Oh, I have like energy," but I was like, I had the weird rush. That was really interesting to me because he was like not buying anything I was saying. It was just interesting. So I admit there's something going on, but either way, my point with all that is hydrogen gas is typically quite a mild molecule, and so that's a good thing. It's not like morphine I was saying that's just like you take it and you're just like, whoa, give me another or something.
Yeah.
Maybe.
So interestingly, and I was leading into the exercise and the lifestyle diseases. In my reviewing the literature, it seems like the clearest use of hydrogen that we're observing a very dose-dependent response is in metabolic, mitochondrial, targeted issues. It really seems very clear that so far the more hydrogen in the higher dose, the better the response. From the metabolic syndrome studies to the fatty liver to there was those mitochondrial dysfunction, early comparative study. It seems very clear that as we've gone in these higher dosages, the biological markers that are changing are changing more frequently and to a larger extent, right?
That's maybe true. I don't
want to put you on the spot to make a definitive statement. It's simply my observation.
Yeah, I think there are. I think that we are going to be better off with the higher concentration, and as researchers, if we can use a higher concentration, especially if we can get closer to the amount to the total dose that animals end up getting, because like I said, they drink so much more water than us. That's what we would rather do. I wouldn't say that we can say definitively that yes, the higher concentration is more effective.
Yeah.
Because I just don't think we have the data. Even with the mitochondrial studies you're talking about, there were actually some other things with those studies. If you look at carefully,
one wasn't blinded, one was double blinded.
Yeah.
They were different durations. One was 8 weeks, one was 12
weeks. Right.
So there was a lot of changes in that one. I'm going more off of. We do have 2 published studies using magnesium rods for metabolic syndrome, then the fatty liver studies, and then the body composition.
Yeah,
that had about 6
and those ones
milligrams
also
of H2.
the better benefits was from they did drink more hydrogen. They had they had a higher dose of hydrogen. So I get it. I know where you're coming from.
Yeah.
I'm just.
I know you're a lot more cautious, right? And especially this trend, and I'm basing this off of 5 human studies and 1, that you guys are working on, and it seems there's a clear
if
trend.
I were to guess, I would agree with you. If I were to guess, I would agree with you. And
that's
as
all
a
we can do right
researcher,
now.
as a researcher, I want to
yeah.
use the higher concentration of hydrogen because that's more in line with what we do in cell studies or we do in animal studies, and that's what we want to do. I'm just saying that we don't have. We need to also have the other data showing that it's not that way.
Yeah.
Right, which we don't have, and so that's going to take a long time. But right now, I mean, it's better to hedge your bets.
Exactly, and that's all. All I'm thinking. I mean, it's by no means definitive proof. It just seems like I said, we've got the 2 metabolic syndrome studies that were already published years ago. The body composition one, they had like 6 milligrams of H2 for 3 months in that one. Our fatty liver, it was like 6 milligrams of H2 in 28 days. and then this new metabolic syndrome one coming out that they got like 15 milligrams of H2.
And the results are really good.
Yeah. So it's, but again, I mean, this is going off a half a dozen studies, you know, in
well,
relatively small.
at least what can be said is that a low concentration of hydrogen cannot be stated that a low concentration will have the same benefits. It might, but you can't say that because that's not what was used in the study, right?
Yeah. So it's just it's really interesting how it's going, and I mean, I like the direction it's going, but we do need a lot more replicative work. We need direct comparative, you know, studies on that, absolutely. And even something Professor Osanich we're talking about, he wants to see, you know, direct analysis, like comparing hydrogen to, say, a mild bout of exercise.
Right. And that's what I was saying. In order to understand its effects as an exercise mimetic, we don't really know that there's certain terminology that needs to be tested to really look at that way.
Yeah. So it's interesting stuff that, you know, needs to come out. I really hope more heart grants come. I know, as you know, I'm talking to a couple teams in Canada now that are, you know, very interested in hydrogen.
Well, I think we'll get more, and especially when we look at emergency medicine. I mean, the American Heart Association, you know, has funded a lot of the hydrogen research. You know, with that, for example, that study there done at Harvard.
Yeah.
So things are coming.
No, for sure. It's building, you know, quite a bit. We need to know more. I tend to try and constantly be readjusting my position as the new evidence is coming out, and I know I'm less cautious than you are, right? So I don't want to put words in your mouth by any means, but I do want to hear your thoughts, because I know you are a lot more cautious than I am, and I do have my biases, because if the trend is showing that what I have is the best, then automatically I'm going to be looking for that confirmation bias. Right?
I can see you do that. Well, I don't know, but like I said, when we look at the research, especially when we look at cell culture studies, I think that's the most fascinating one, because when you drink hydrogen water, I mean, you have a lot of cells in your body, like 37.2 trillion cells, and now if you drink hydrogen water, let's say you get a full gram of hydrogen, right? That milligram has got to be adjusted all throughout. It's going to go and diluted all throughout your entire body, and then the concentration of hydrogen in your actual cells at the cellular level is going to be really quite low. Now, when you look at dose-dependent studies in the cell culture, well, we could start out with, say, about 10 micromolar concentration, and there's really not so much of a therapeutic effect. Then you go to like 20 micromolar concentration, and now we start seeing therapeutic effect. Well, that's about the same concentration you get from drinking a liter of hydrogen saturated water.
So how would it work? You know, to say really look at it.
Let me
use something like the tablets. You know, that might get 10 milligrams.
Well, that's what I'm saying. That's what we get to. So then we get to 20 micromolar, we start seeing a therapeutic effect, and then we go higher, and in some cells, some cell lines, and in some models we look at, you can see a dose-dependent effect all the way to 800 micromolar, or 0.8 millimolar, which is 1.6 milligrams per liter. So that would mean that your body is actually saturated with hydrogen gas. So you could not take enough tablets or inhale. You'd have to inhale 100% hydrogen gas to get to that concentration. Of course, there'd be no oxygen. But you could do hyperbaric. We could calculate this. This would be interesting, but we'll do it another time.
Okay, so that's data I didn't even know. That like in cell cultures, you guys have seen dose dependent responses.
Yeah, up to 0.8.
In some
millimolar.
Yeah, in some lines. So that's pretty cool. So I want to just get into a little bit. I know it's something you're interested in. We mentioned before Tyler's master's in sports science.
Yeah, exercise for sports conditioning, exercise physiology.
So we're adding, to our line as an essential. Actually, it might already be added by the time this gets published. Creatine, and I know creatine is actually the biggest topic of Professor Dosage's research. It's quickly becoming hydrogen, but creatine before that, and I know you like creatine, or you take it for exercise.
Yeah, I wrote a paper on that, like, let's see, 8-9 years ago or something. It's the creatine recommendation report. I just was interested in this area, and I looked at a ton of stuff, and I even did some mass spectroscopy studies trying to understand the stability of creatine. There's a lot of claims out there that I wanted to understand better, but it actually needs to be updated. But anyway.
Well, yeah, of course, in 8-9 years, and
yeah.
A lot of the research is trending on creatine now as an overall health supplement, especially in the elderly. And I remember, shooting you a text. Might have been a year ago or something, and I said I'm really starting to think of creatine more as like a health supplement than an exercise supplement. To exercise supplement second, and that's how I think of hydrogen. Hydrogen is a healthy aging supplement. It's an exercise supplement second, right? And you said, I think I agree, but I'd have to think about it more, type thing. And
just only because. Well, I'm just a very cautious person. I don't like taking anything, even vitamins or minerals or anything that, I like to really look at things, because often things end up hurting more than they ever end up helping. And I just try to eat a really good diet. That's the number one thing. But I don't eat really any meat, and so my creatine levels would be a lot lower. And so I am one of the ones that respond very well to creatine. And we understand the reasons why there are responders and non-responders of creatine based upon primarily based upon activity of creatine kinase and muscle levels of creatine. You have to increase the creatine levels by about 20 millimoles in order to start seeing those increases. So just some of the things about creatine in terms of its metabolism in the gastrointestinal tract and different things that I was just kind of curious at. But if we look at the safety data, which is it's very obvious, it's very safe, but then we look at some of the clinical benefits of people with like various neurological conditions, from depression or Alzheimer's or whatever. It just, creatine has a lot of very strong therapeutic effects.
And my thoughts, and when I brought it up to Professor Dosage, she said 100%. We talked about it a month ago, and I thought hydrogen might be synergistic with creatine in a lot of ways, and he told me that he believes he wants to do studies on it, but in his lab, they believe that hydrogen might improve the bioavailability of creatine when taken, and that's an interesting thought, because we get those anecdotes from a lot of customers. We need to study that.
Well, sure. I understand what maybe I'll talk to him. I'm going to go down there a little bit, but what we mean by bioavailability, because creatine, well, there's a lot of things, from
or maybe
absorption,
the potency or
maybe
something.
Because you have it's getting into the bloodstream, and then it's getting into the muscle cells, with the creatine transporter, the sodium chloride dependent transporter, and then it's regulated by it's just 65%, I think, is in the phosphorylated form. So creatine kinase regulates that. So hydrogen gas, it has an effect in regulating some of these enzymatic activities. It increases bioenergetics. So if hydrogen gas could increase has some effects by increasing bioenergetics, it might actually be able to increase the amount of creatine phosphate storage. By increasing the amount of phosphorylated creatine, that is going to increase the uptake of creatine. That can help convert non-responders to responders. Now that's actually
and that's actually something that Professor Dosage and I were talking about, is a responder versus non-responder, and we talked about this a little bit. He said that we're actually starting to study that and see that caffeine, creatine, are both compounds with.
Well, creatine we know is a non-responder, but like I said, because a lot of people who eat meat on a daily basis are things that are getting an extra 2 grams or more of creatine from the meat, and so their muscle creatine levels are already quite full, and so they are not going to respond very well from creatine unless they do some biohacks, which I've talked about before, with increasing creatine activity and creatine kinase activity and different things. But I actually wonder maybe hydrogen gas could do some of that. Caffeine, yeah, I don't know about the, obviously there'd be responders versus non-responders, because people who are habitual caffeine drinkers, for example, you can start having some down regulation of
Caffeine's a
H2
really
receptors.
interesting one. That's another essential we're adding. The overall health benefits of smaller amounts of caffeine, and one of the dangers.
Like how many milligrams?
100 to 400 max, I think, a day. Right.
Yeah.
Sometimes
That's,
a lot of like a Starbucks coffee might have 300-400 milligrams of caffeine,
Right.
and then people drink multiple a day, and now that could be dangerous, right? It could be too much caffeine. We need to remember.
Well, coffee also has a lot of antagonistic molecules combined with the caffeine, so it's not just it has this caffeine, and so 800 milligrams in a cup of coffee. Not that it's that high, but that's probably not accurate to just say it's the same as the dose of 800 milligrams of caffeine.
And then you look at energy drinks. A lot of kids, they die from energy drinks, but there's all these other molecules.
Well, they add like, I think, theobromine, which is a metabolite of caffeine, and different things, and guaranara or different things in there.
Yeah, there's a lot of different things at play. So I know caffeine isolated has been studied in a lot of molecules, and because of all of this confusion in a lot of products where they're adding all these things that may alter how caffeine works or sensitivity, we're just adding, it's just pure caffeine, 100 milligrams a pill.
Okay,
so that's one thing where we're adding that again might already be added by the time.
Well, caffeine is one of the few molecules that have been demonstrated that it can be quite safe, and it can have quite a few therapeutic benefits as well.
And for like legal supplements on the market, not going into illegal performance enhancers.
Well, yeah, as far as an
caffeine
ergogenic enhancer, caffeine is one of the very few that legitimately
works and can work in a single dose.
Yeah.
Like
Yeah.
increase performance in an
In fact,
acute single dose.
taking it chronically may actually make it not work.
Yeah.
Because then you get sensitive to it and things. So, yeah, if you're gonna use caffeine for for the performance, it's best to not even take caffeine unless you're gonna perform.
Yeah.
But there are some other potential benefits from daily
habitual use.
Yeah, habitual use.
Yeah, absolutely. That's my thoughts, anyways. And one last thing I wanted to talk to you about. It's interesting, and talking to say my legal counsel and consultants, and getting studies, definitions are so important. Say if we do a study like in the U.S. and we just call it an obese population, right? Then say our results can be a structure function claim, because it's restoring proper function of the body. But all of a sudden you call it a disease state, right? And now it's drug. And it's really funny how regulations and bureaucracy like that works.
Yeah.
Because if you take, say, an obese population, 90% of them are going to have metabolic syndrome or NAFLD, or in many cases maybe
Diabetes
70% of them
something.
both.
Yeah.
Right? So it's really funny how it works, and it's really funny how studies are often done that are industry funded, because they have to be so careful with the wording, even though it's the exact same thing. But then in academia, you're going to want to define it properly.
Yeah.
In the research, know what you're looking at, because even in an obese population, they don't necessarily have elevated markers, right? Like it isn't perfect. If someone's overweight, they might still be metabolically healthy.
Oh yeah,
Right?
Fit obese people is great because they're often stronger, lower risks of osteoporosis.
Well, I was telling you, even like I've started trying to get back on the road to fitness the last few months, and I'm down 25 pounds. But even when I hit like 265, which was a 90-pound gain from when I was active before my shoulder fell apart and hit arthritis in like 8 spots, but none of my markers were elevated.
Mhm.
My fasting glucose was fine. My triglycerides were fine. My blood pressure was fine. You know, my cholesterol was fine. It was just so interesting that I gained 90 pounds in such a short amount of time, and there seemed to be no impairment, because you'd look, you know, and be like, that's morbidly obese, you know, and probably diabetes or
Mhm.
pre-diabetes, and it just wasn't the case. And it's why some of these things are strongly correlated, and it's why in academia
It's
you're
not a
going to want to
causative
look,
thing.
you're
Yeah.
going to want to make sure. But in industry, they're going to want to just take obese people and call it that, right? Because now you can make the claim.
Yeah, it's interesting. I don't.
Because for some reason,
really worry
you know,
about that
lifestyle stuff like
much, but-
metabolic syndrome
Yeah.
might be a disease, maybe not, but there's a stigma. We can't call obesity a disease.
Yeah. Well, then there's politics and things. Yeah. Yeah. That's it is interesting there. Yeah. But you again, when you gain all that weight, I mean, you were also not, you know, 50, 60 years old.
Yeah.
You were quite young still, so that could, and you were healthy. I think there is something about people who are healthy and very fit, younger, and having just certain epigenetic expressions and
Yeah, and I
things.
stopped working on my upper body, but I didn't stop working on my legs. I was still
Yeah,
doing squats
and
every day.
We know the
you know,
squats
hiking
and things have great benefits for the brain and things,
Yeah.
even though you know, totally separate organs.
Yeah, no, absolutely. So there are some things like that, but it's just so interesting. I just wanted to bring it up because of just wording in studies,
Mhm.
you know, and everyone will be like, oh, you know, is that claim FDA approved? And it's like, the FDA doesn't approve any claims on supplements for anything that could be construed as
Right, 'cause
a
it's a
disease
supplement.
claim.
FDA
Exactly.
deals with
But
drugs.
If you take a healthy population or a normal population, and obese
Right.
is considered that, and then you talk about markers, then it's restoring proper function, right? But if you label a
Mhm.
group,
As a disease.
now that's a direct disease
Right.
and drug claim, and it's just so funny how the bureaucracy works. Because, well, even in the healthy population, the FDA doesn't approve the claims. You can make the claim, and you have to hold the studies on hand in case they ask.
Sure.
Right.
Yeah. They're not going to approve the claim. They're just going to say,
Why
"Yeah,
did you?
did
Why
the
are you
studies."
making this claim? Right, is what they'll
Right.
say. You show them the evidence, and they go, okay,
Right.
or they say, no, we don't agree, don't use it anymore. So they're really they're a reactionary agency in that sense, and they don't approve any claim ever. So if supplement companies are making claims on their label in the marketing, they might be within their legal right, but that doesn't mean the FDA approved it, because there is no avenue for the FDA
Right.
to approve that. We could, you know, go through
You become a drug.
100 studies, but then you have to become a drug, right? And then it changes the cost, it changes how you can sell it. So there is no amount of evidence a
To
supplement
get approved by the FDA.
Yes, exactly. That a supplement could gather. You
Well,
could,
it belies the very definition of the FDA. Of
Yeah.
the FDA.
Yeah, exactly. Well, I think we covered everything we wanted, anyways. So, thanks again for
Okay.
coming to town.
All right.
All right. Thank you, everyone, for watching.